Let's talk about the information infrastructure a little bit. What's the foundation of the ACO analytics?
Sure. So I can take that one. So in order to be successful in an ACO or any value-based program, we've learned that you need to have access to lots of data and you need to make that data work for you. As we set out to assess a couple of years ago our analytics options and potential vendor partners, we quickly learned that we needed to seek certain foundational capabilities. First, we needed to create an expansive data set as our foundation, which allowed for integration of many disparate data sets as we took on all these new VBC contracts and new populations that Dr. Parikh referenced. We wanted to move beyond the limited clinical data that was in our EHR and incorporate medical and pharmacy claims data from our health plan partners, as well as clinical alerts of encounters that were occurring outside of our four walls by adding in ADT notifications. Secondly, we wanted really our workflows in the clinics to be data-driven. So we prioritized the use cases where we wanted data to drive workflows. For example, active management of patient attribution is critical for success in accountable care. And this includes knowing who your patients are, where they are, how sick they are, and what services they need to achieve optimal outcomes. So as we invested in FTEs to support coding and quality and overall patient management, we were focused on ensuring that those staff were using the data to drive their daily workflows in those areas. And the third foundation was we really wanted our analytics teams to have direct access to normalized data sets, allowing them to calculate performance on all critical components of value-based care success and develop enhanced and predictive analytics that would grow in sophistication and impactability as our care teams were growing in their ability to use the data to inform their workflows. And we also needed our analytics teams to generate scorecards from these data sets that our providers and care teams could use to know that their workflows were making a difference in improving health outcomes. So those are a few of the foundational capabilities that we felt were really needed, where we needed data to support.